The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about the eyes today. If you're not happy with the way you are aging in and around your eyes, you have to hear what my first guest has to say. He is an oculoplastic surgeon, Dr. Weiss. Dr. Weiss, welcome to the program.
Well, thanks for inviting me, Randy.
Okay, before we get into today's topic, what are the different procedures you do, and who's your typical patient?
There's no typical patient, but in oculoplastic surgery, being in Newport Beach, my practice is generally gravitated toward the cosmetic side. So I would say my typical patient is someone who wants to look a little and feel a little bit better about themselves, particularly when it relates to the eye. So people who maybe can't keep the eyelids open or have a lot of fullness on their eyelids. A lot of people have baggy lower lids, and they have dark circles under the eyes. It makes them look tired. So we like to try to make people look more relaxed and alert.
And you get referrals from some plastic surgeons, other guys.
I do.
Is that right?
I see. Well, we're the experts in the eyelids, and if there's ever any complicated procedure or delicate procedure that has to be done around the eyes, it finds its way to an oculoplastic surgeon.
All right, now you're known all over the world. I mean, Nelson Mandela went to you. You took care of his eyes.
That was a big honor.
How does that happen, by the way?
Well, I happen to be well known at what I do in oculoplastic surgery, and in this particular problem that he had, I happen to have some experience.
Okay, so on to today's topic. First off, with the eyes. How important do you think the eyes are when it comes to the aging process?
Well, look at us now. We're looking at each other. We're looking at each other's eyes. We're not looking at each other's chests. So the eyes are the first thing that people notice about us. And if they look tired, and they actually are the first part of the face that gets wrinkled. In fact, of the people that come in to see me, their cheeks look great, but their eyelids show the signs of aging.
All right,
so the first thing that really people notice about themselves when they look in the mirror and they start to get my age is they notice the wrinkles around their eyes. So the eyes are the first signs of aging, but it also are the first signs of people looking tired, maybe not feeling tired. A common complaint I get is that a person comes in and says, you know, my coworker or my sister says I look so tired, but I'm not tired. I got a great night's sleep.
Okay.
It's because of the wrinkles and the bags and the shadows around the eyes. And that's a simple thing to take care of.
Is that a tricky area, by the way? Is that a tough area under the eyes? Because I know a lot of plastic guys that don't like to touch under the eyes.
Well, it's a delicate area to work on, but I think that if you have the experience to work on it, it's a very safe procedure.
How often do you do these things that we're talking about today?
Just about every day.
Every day? Mm-hmm. Because I know eye guys, and I always tell, look, I don't endorse people. People will email us, who do you go to? I say, go to a specialist. Mm-hmm. That's always my response. Mm-hmm. I mean, the fact that, 25 years you've been in Newport Beach, restricting your practice to eyes?
Yes.
How much better are you now than you were 10 years ago, 15 years ago?
Well, practice makes perfect, Randy, and I think that I've gotten a lot of practice. And by the way, beforehand, I think I misspoke. I said I do it every day. I don't do it on Fridays because I'd like to see the patient personally the next day. So I make sure that the surgery days are Monday through Thursday.
And you're a hands-on guy. You say it's kind of like
I can't help myself.
Labeling you like a perfectionist, but like almost obsessive about. You say you don't have RNs doing things.
I don't delegate too many things. I see the patient at the consultation beforehand. I do all the surgery myself. I see the patient on the first day. I even take out the stitches myself. In fact, I call every patient that night to make sure they're all tucked away and feeling good about themselves.
Okay. Now, and by the way, when should somebody do something about their eyes? Or get a consult?
I think that somebody should do something when they look in the mirror and it's something. A lot of people come in and say, what do I need, Dr. Weiss? And I say, I just try to turn the mirror around and ask them, what are you concerned about? Because
what do they always say every time?
Well, I don't want people to do surgery because I'm concerned about something. I want them to do surgery because they're concerned about something. I like to solve problems, not create them. So when someone comes to my office and asks that question, I certainly don't want to point out things that never occurred to them and have them leave my office feeling worse than they did. I'm in the business of making people feel better about themselves, not pointing out things about themselves.
One of the things you said, which I liked, we're talking in our green room, and you said that you're amazed. I'm paraphrasing. They're all smiles after the procedure's done, just a couple of days later.
One of the big senses of
because it sounds like an exaggeration a little bit.
Well, it's not really. One of the big senses of satisfaction that I have, I must say to patients, you've made my day a half a dozen times a day. And that's for two reasons. One is from the satisfaction I get from doing a perfect job, but it's also from the sense of happiness that I sense from these patients. Patients come in on the first day and they just have a smile from ear to ear. And it makes me happy and it's infectious. It makes the office happy.
Okay, then we're talking about above the eye, the brows,
Well,
under
really,
the
whatever
eye.
procedure they get, all the procedures that I do, I'm lucky. The specialty that I work in, a lot of these procedures can be performed under local anesthesia. You don't have to go to the hospital.
Okay.
And they're very fast recovering procedures. So a patient can come in fairly quickly and feel very good about themselves and already see the result. Many times, even before they go home, in fact, every patient that I operate on, I grab the mirror afterwards before they leave the operating table and I hold it up to them. And even then, they're going to have a big smile on their face.
Now, we're going to show these photos in just a second, what you're doing. But one of the things that I don't hear from doctors, you said perfect. You want to make it perfect.
Well, I'm kind of
Elaborate on that.
I'm kind of a perfectionist. And in the one sense, I don't delegate to someone else to do any of the
What does
jobs
that
in
mean
my
to you,
office.
perfect? I mean, what's the perfect?
The perfect thing is to make somebody natural. The thing that we appreciate most with cosmetic surgery is a natural look. And what that really means is, among other things, the most important thing is symmetry. So if we can get somebody symmetric, they'll look very, very natural if you don't alter the tissues too much or pull things. But the most important thing in making someone look natural is making them look completely symmetric. So I have a special operating table that sits you to an upright position.
You mean one eye matching the other eye?
Yes.
Okay.
And when I'm done all my work and with all my special techniques and sutures and
You
everything.
got some secrets, by the way?
Despite all the special sauce and everything, at the end of the procedure, when they're sutured up, we sit them up on a special operating table that I have, and I walk around, and I'll look at them.
Interesting.
And if it's not exactly perfect, then I'll sit them back down, I'll take out the stitches, and just take out a little bit.
Like on a blepharoplasty.
On a blepharoplasty, just
Like
a
the skin
little
over
bit of
the eye.
skin. And then close it up again. And
Is that unheard
it
of, by
makes
the
a
way?
big difference, and it makes me more satisfied when I leave the operating room.
Is that unheard of, by the way? Giving me the inside scoop? I mean, most guys that would sit them up
Going
and take a
down.
look.
Some people don't feel that you can tell at the time of surgery, but there are certain techniques that I use to be able to tell.
Okay.
One of them is using a substance in the local injection that diffuses very rapidly so that it doesn't cause any distortion, and it allows me to be able to tell during surgery. And also, the way that I operate, the techniques that I use, don't create much bruising, if any. So if there's no bruising and the local anesthetic is diffused, I could tell exactly what it's going to look like, so that when a patient sits up, if there's a little bit of a difference, I'd like to take care of it before you leave the operating room. I don't like to hope that it gets better later. I like to take care of it when we
And
finish.
these people, by the way, because I saw your videos and they're on your website, 2 days later, no bruising.
Not in every case, but in many cases.
But I mean, it can happen.
Yes.
Okay, now I'm trying not to endorse you. People need to know that I just met you today, that I'm not siding with you here, but those are some of the most dramatic photos I've ever seen.
Well, thank you.
So this is going to be good. Okay.
Well, I don't know how many of these will be able to get in, but
Okay.
I brought a representative sample of people at different ages, men and women, some Asians, some darker complexions, lighter complexions, and various different procedures on the upper lid, the brow, and the lower lid. Okay, here's a woman, and she comes in feeling, when she's looking in the mirror, she sees all the crepey skin above her. That's all she can see.
Okay.
And obviously, when we look at these pictures, the before picture, there's a significant amount of fullness and heaviness in her skin. In the lower lid, if you'll notice, there's a little bit of a bulge that's causing that shadow. The dark circle is a shadow.
How old is that woman, by the way?
She's about 48.
Interesting. Okay, she
Okay.
looks much older. So the skin over her eyes bugs her. Mm-hmm. Okay. And what do you see as a surgeon? When you look at that, what do you see?
Well, I see that the brow is in a good position. It's actually in a high normal position. So there's nothing we have to do. Whenever I evaluate someone's eyelids, the first thing that I do is evaluate the position of their eyebrow, because it's intimately related to what we do with the eyelids. Sometimes you can't even make an improvement unless you do the eyebrow. In this person, her eyebrow is great. So we focus on the eyelids. Now, look at the crepey skin, especially on the outside part.
Crepey meaning what? That's the little wrinkly skin.
Yes, that's the wrinkly skin and fullness in her upper lids. In fact, the wrinkliness, you can follow it all along. In this patient, we wanted to address the crepey skin in her upper lids. So we removed some of the crepey skin on the upper lids and the fat that was causing the fullness. And we also removed the fat in the lower lid that was causing the bulging. In the lower lid, we did it from behind the eyelid without even making a skin incision.
Okay.
Now, if you look at the after picture,
Wow. Now that doesn't even look like the same person.
well, you can see how clean it is. Basically, we try to clean things up so that it looks very natural and non-surgical afterwards. And you'll notice in the lower lid, that shadow is not there anymore.
You call it a shadow. Did you add fat?
Most of the time, when people have a dark shadow in the lower lid, the skin is not dark. Now, sometimes it is, but most of the time it's because of shadow.
So it's a shadow.
Yeah, and
Okay.
it's because there's excess fat bulging out. And since most light comes from above, it hits that bulginess and it forms a shadow beneath the eye. So basically,
So you didn't add fat?
No, I didn't add fat, and I didn't even have to take out any skin. All we did with this patient was take out a little bit of fat from behind the eyelid, but we have other pictures that show that a little bit better.
Now, when you say, we talked on the phone, when you say you have to be careful, you take too much skin, it's not good over the eye. What does that mean? Tell me about that, because I always feel like I could spot that hollow. I think it makes people look older.
Well, Randy, there's two phases of getting experience doing plastic surgery. One is to know exactly how to do the procedure. And the other part is exactly how much to do the procedure.
All right.
The most important one is how much. And I think that what we've learned is less is more, but that's where the artistry comes in. I used to think that was a little bit corny when I first started in practice, and I listened to other plastic surgeons talking about the artistry of cosmetic surgery. But
you thought it was corny? It was
that's
just
no joke.
Really?
That's no joke. There is some kind of a secret magical skill that's involved. There is a unnameable skill that's involved. It's as far as being a musician or an artist or a painter that you can't put your finger on it, but it really makes the results much better in some people's hand than others. They could do the same procedure, but if you just take out a little bit different amount of skin or move the tissue in a different way, you can get vastly different results. The one
so
that
before and after, I mean, that before and after looks very natural. If I saw that after walking down the street, I wouldn't think something was done.
So thank you very much.
And by the way, I should mention, Newport Beach, doctors from all over the country, they come in here for interviews. We air throughout the U.S. and Canada, and they always say, Newport Beach, that's where you get bad results. Well, this is fantastic results.
Well, Newport Beach, what it's done for me is people there are very demanding. They can go anywhere in the world and get their plastic surgery. Many people can. They can go anywhere in the world. They could choose from among 40 or 50 plastic surgeons in the same building. And I'm flattered that they come to me, and I'm well known for eyelid surgery and eyelid reconstruction because, as you can see in the next picture, which is the same patient from the side, you see that temporal overhang? We call that a temporal overhang when the skin hangs over the outside in the before. And then when you look at the after, you can see how natural that looks, and that overhang isn't there. Now, this woman was very, very happy because now she could put on makeup, she could wear eyeliner, she can just look and feel better about herself.
What does she say, by the way? I mean, I'm pretty happy with the results.
Ecstatic. These people are very ecstatic with a small amount of surgery.
Because this is small, really, but it does. I mean, completely different person.
Let's go on to the next picture.
Your race about 7 years, would you say? You think? With just the eyes?
I think that's up to you to say.
What do you hear?
Well,
what do they say?
With these procedures, people look more relaxed, they feel more alert. They are more alert and they feel more alert because they no longer have to struggle to keep their eyelids open.
But in this economy, though, is this one of those things that people really need to do? I mean,
I think that in this economy, the biggest bang for the buck in facial cosmetic surgery is eyelid surgery.
Interesting.
For the smallest amount of surgery.
Eye around the eye surgery.
Right, around the eye surgery. As far as making the biggest improvement in one's appearance in the simplest and safest and fastest and most cost-effective way possible, it's eyelid surgery.
These are good photos.
Well, thank you, Randy.
And I see a lot of these photos.
Thank you. I'm really proud of these.
Okay. Well, I'd have to also tell people that if they're just tuning in that this is not an endorsement for you. This is a real interview. But the fact is, I would say around the eyes, and I've interviewed, at least a couple of hundred cosmetic and plastic surgeons. These are probably some of the best or the best that I've seen. And that bottom one in particular, it's hard for me to believe because I'm always thinking laser or I'm always thinking, add fat volume to the face. And this is a different approach in this particular case. Yeah, You're saying you just remove the shadow.
In this woman, we didn't even make any skin incision at all in her lower lid. We just took out the fat because most light comes from above, it forms a shadow beneath her eyelids.
Okay.
So all we have to do is take out the fat. We avoid a skin incision and we avoid a lot of risk.
I think it's interesting too about you. I got to tell you this. So we're in the green room, and you're showing me your before and after photos like they're baby pictures.
Yes.
You're pretty proud of these things.
Well, I am because a lot of that's my pet peeve. I see a lot of pictures that are the befores are always darker and the afters are always lighter. And
so there's not special lighting on the before and after.
I bent over backwards to try to make these as accurate a representation as possible.
Okay, good.
About what's possible with this kind of surgery.
Now, when it's done, what does she say?
Oh, she's ecstatic. She has she feels better about herself, and she certainly looks less tired. I think the main thing in her case was that she was just ecstatic about the improvement we made in her lower lid.
Is there a concern, by the way, that they don't want other people to know by any chance?
Most people don't want anybody else to know, which brings us to recovery time. Some people ask me, well, I'm having a wedding coming up. Can I do the surgery and have time? Usually the recovery time for most of these procedures is about 8 or 9 days. But I usually tell people they have different recovery times. If you're going to be the mother or the bride, give yourself 6 to 8 weeks. If you're going to be the bride, give yourself a little bit longer. But most working people, if they take off a week, or some
What about me? Can I be back in a week? Because I wear a lot of makeup. Remember that. No, I'm kidding.
It may take 5 or 6 months in you. I'm only kidding.
Okay. So, but downtime, can be short.
Yes. Well, in other words, if this person only had the fat underneath her eyelids, sometimes you can get back to work in a few days.
Okay, good.
In fact, with a pair of sunglasses, you can go shopping on the second day and nobody would know that you had anything done.
Okay, good. So now your other photos, and we're going to take a quick break.
Okay.
Good stuff, by the way. It's very, very good photos.
Okay, so in the before picture, she was concerned about the fullness that she has in her upper lid. And in the, if you'll notice...
It's like she has no upper lid at all.
Well, I remember her very well. And when I explain things to patients, I give them options. And I help them make a decision, an informed decision. Now, in her particular case, she had lower eyebrows, and she also had a lot of fullness on the upper lid, fullness and extra skin and fat. If you look at her lower lid, you see she had a lot of bulginess that was causing a shadow. In her lower lid, there's not much of a question about how to make the improvement. I removed the fat from behind the eyelid without making a skin incision.
Okay.
If you look at her upper lid, she has an option to either raise the brow or make the improvement through the eyelid. If you look at her lower lids, the shadow is gone. So she looked a lot more awake and alert. She was very happy about the way that she looked after surgery because of a very natural improvement. Here's another patient.
Okay.
And if you look at her, what we did with her was...
She looks angry on the before.
And the reason she looks a little bit angry is because the brows are tilted downward in the middle. And I remember her quite well. On the day of the preoperative exam, we decided to change our technique. Initially, she just wanted to do the upper lids. But when
the skin, when you say upper lids, we're talking about the skin.
Yeah, the upper lid surgery. But when we went over the options, we decided to do the brow lift also. As you can see from the after picture, her brow is just in a much more relaxed and neutral position. So
nice.
it gave us the ability to give a very natural result for the upper lid surgery.
It's prettier in the after.
She jumped up
the first. Thinner, by the way.
She does. She jumped up afterwards and gave me a big hug on the first day because we decided to do that brow lift.
So you're just picking up just the center?
Or we're lifting it all over, but mostly in the center in her case.
Okay, interesting.
When you look at the after, a lot of people are very concerned about looking too surprised after a brow lift.
Yeah, I don't like brow lifts. I told you. I'm not a surgeon, but I feel like I could spot them. It's too high.
Well, as you can see from this after picture, it's very natural.
Yeah.
This is taken about 1 month after surgery. And she was just ecstatic with her result. And that stays that way for a long time. Okay, here's another patient, and you can see how an improvement can be made without lifting the brow. Again, in this person's case, if you look at the upper lid where there's all that overhang and fullness, I took out the fullness and we didn't even change the eyebrow position. But if you look at the after picture,
very nice.
What do you think?
Yeah, no, she looks younger, rested.
And then
what about under the eye?
In her case, I took out a little bit of fat underneath the eyelid, almost as an afterthought. But you know what? It made a bigger improvement. It looks even better in person than it does in the picture.
Okay, one more photo and we're going to a break. This is dramatic, by the way.
Okay, now this is a picture of a person with, nobody would argue that the first and most obvious feature about her face was her full eyelids. And if you look at the after picture, it's like night and day.
Very nice. It's very nice. And this is somebody that comes in and no brow lift in this particular case.
No, that's not necessary in her case. Her brows are in a great position.
Okay, good. We're going to take a quick break. We come back, more of these photos, okay? And more about the process, what people can expect on day one. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about what you can do for your aging eyes. We'll be right back.
Surgery was easy. I was awake. We were talking. We were laughing.
There was no pain at all. And listen to Stevie Wonder.
That's right.
From the first week I got back to work, they're like, oh my goodness, Lucy, what have you done? You look great.
I had comments all the way from the people who knew that I had it done, telling me that my eyes look fabulous, saying, gee, you just look a little bit better. Oh, you look well rested.
Wow, you look like the woman I married 20 plus years ago. He says, you look great. So now all of a sudden I'm getting more chairs pulled out for me. I'm getting a lot of attention, and it's wonderful.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, the aging face, specifically in and around the eyes. What can be done? What are the new breakthroughs? With us, we have an expert on the topic, oculoplastic surgeon from Newport Beach, Dr. Weiss. Okay. And for people just tuning in, I mean, this is all you do. I mean, you've restricted your practice.
Yes, I have a passion for this.
To just the eyes.
You know, the techniques that I use are brow lift, upper eyelid surgery, lower eyelid surgery, laser skin resurfacing, Botox, procedures like that that affect the area of the face around the eye.
And you're a perfectionist. You're going for perfection, you say.
Well, it's a rejuvenate.
Is that
Most
right?
of what I do is rejuvenating surgery. Is making people look younger and more relaxed.
Okay. Now, we looked at a lot of photos. These are all on your website. Is that right? They can look there. Asians. You have a picture of some...
Very challenging, and I'd like to show you one of the cases that I take the most satisfaction from.
Okay.
This is a woman that felt very self-conscious about not having an eyelid crease on one side. If you look at her right upper lid,
pretty
if you look at her right upper lid, you'll notice she doesn't have an eyelid crease. In the left upper lid she does, and the right upper lid she doesn't.
It's very subtle. Interesting.
Now that's a very challenging case. Well, what I did was, if you look at the after picture, now you look at the pictures and the right eyelid matches the left eyelid.
I'm surprised she would even notice that.
Well, she was terribly self-conscious, and Asians have a different problem than we do. Their eyelid crease is very important. As a matter of fact, as I mentioned, this is the one that gives me the most satisfaction because it actually took the most surgical skill. But if you look at the next patient is also an Asian. He's an Asian man, and he has no eyelid crease at all.
Okay.
And in the lower lid, you'll notice there's a little bit of fullness. But if you look at the upper lid, the skin is actually hanging over his lashes. It's just resting on his lashes.
All right, and by the way, as far as the Asian community, do you see a lot of this coming in? People that
Well,
don't
being in
like
Orange County, I do see a lot of Asian eyes. I'm somewhat of an Asian eyelid specialist. As a matter of fact, when somebody wants to have eyelid creases formed, they come to an oculoplastic surgeon such as myself. As a matter of fact, as you'll see in this next picture, this is the man after surgery.
Very nice.
No, it's very. The reason I like this picture, and the patient was happy with this picture, is because it was very natural. The biggest fear that people have, again, before eyelid surgery is that it will look unnatural. So
well, that would definitely be my fear.
I pride myself on creating natural appearing patients. This picture is typical of upper eyelid hooding.
Okay.
There was a lot of skin and fat on this man's eyelid, and that's kind of typical. There's a lot of people walking around who have eyelids like this. It's not that much more difficult to create a nice improvement than just taking out a little bit.
And so with him, what'd you do?
If you look at the after picture, if you look at the upper lid, I took out the upper lid, and this is all done under local anesthesia. He didn't have to go to sleep for this. I took out the upper lid skin and some fullness that was, some fat that was causing the fullness. And afterwards you can see, he looked, well, what do you think? He looks very symmetric.
Well, it looks very
natural.
Okay, good. We have time for probably just a couple of more.
Okay, well, this is a good picture that shows how easy it is to make an improvement in the lower lid. Just by taking out a little bit of fat. You see this man?
Yeah.
Okay, now if you look at his before picture, there's a big shadow underneath his eyelid. All I did was take out the fat from behind the eyelid, and his recovery time was just a matter of days. There were no incisions made in his skin at all.
Interesting. And by the way, you know, just to cut in, because I'm being brainwashed like everybody else, because you always hear add volume, add volume, add volume to the face. But this looks like you're adding volume. No, you're eliminating the shadow.
Well, I think there is a place for adding volume, but it has to be done judiciously.
Okay.
There are some conditions where people have a groove between their eyelid and their nose, and it's definitely preferable to maybe we have a new procedure, a relatively new procedure, where we transpose the fat into that area.
Okay.
The real goal, Randy, is to create the best contour and the most natural looking contour between your eyelash, your lower eyelash, down onto the cheek. I think that you can see this in the next picture. You see this woman here. You see the big shadow that she has just from the bulge, and we made that improvement. I made that improvement just by taking out a little fat from behind her eyelid. Randy, you know, I have 3 more pictures that I think are really important. Can I show those?
About a minute.
Okay. You see this picture? Here's a woman that we did her upper lids like with the ones we did before, but in the lower lid, we made that improvement by taking out the fat and also tightening the eyelid, because as we get older, it needs to be tightened, and that's a special technique that's done among oculoplastic surgeons that makes the operation much more safe.
Very nice.
This next picture here, guess what was done in this picture?
Same procedure.
Well, no, this was a different procedure. And look at the lower eyelids only. In the lower eyelids in this woman, all that crepiness was taken away with laser skin resurfacing with the CO2 laser.
So underneath the eyes, just laser. And you did the laser.
Yes, and it's commonly a procedure that I like. I became an expert with the CO2 laser when I was on the staff at Beckman Laser Institute in 1996. And it is because it's the best and most accurate way of improving the wrinkles in the area around the eye and the upper cheek. And that in this woman, all we did was use a laser. We didn't do any cutting surgery at all. And for our last picture, I want to show people the fact that sometimes people come in and they want insurance to cover their procedure. Well, this is the type this is the type of procedure that insurance covers. This is a woman who has true ptosis, that's spelled with a P, P-T-O-S-I-S. And she could barely see out of her eyes in the before picture.
Is that right? That's
that's the eyelid level. That's when we raise the eyelid level. And again, that's a special oculoplastic technique.
Okay, good. I want to thank you for coming on the show. By the way, a lot of stuff to cover. And by the way, if you're watching this, we have a long version. We call it the uncut version on our website at wellnesshour.com. All you have to do is look under Dr. Weiss, and you'll be able to see that. You'll also have the long version on your website if you like. But a lot of things to mention. You've got a charity. You're involved in some patents. You're a science guy. A lot of research. We're out of time. I want to thank you for coming on the show. Very good stuff. So all of these photos are on your website.
Yes, they are.
And consultations? They all meet with you?
The cosmetic consultations are private consultations, and they all meet with me. They're complimentary.
Okay, good. And if they want to find out about your charity?
Go to One World Sight Project, or endblindness.org, and you'll find out about how to cure blindness around the world, how we're curing blindness around the world.
You're committed to this. I mean, this is one of your passions.
Well, I was inspired to start this charity by a song that I wrote about blind people, and it just one thing led to another, and it made me start this charity.
You're a jazz
many years
musician.
ago. Yes, I am, and I think that's the improvisation with jazz helps me in oculoplastic surgery.
How so?
You have to do a lot of thinking on your feet. You don't always know exactly what cuts you're going to make until you get into surgery. So it's a lot of thinking on your feet. It's the same kind of skill.
I want to thank you for coming on the show. Very good.
Thanks for inviting me.
Excellent stuff. Watch the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go online at thewellnesshour.com. In fact, if you want to see the long version of this, talks a little bit more about his background and training, his charity. I guess you have patents as well. A lot of things we didn't talk about. We'll have to have you
the
back.
painless Botox patent. Did we talk about that?
No, we didn't. Painless Botox patent. So we'll put that on the outtakes. But again, very interesting. And if you don't like the way you're aging, you may want to, especially around the eyes, you may want to take a look, go to his website and find out more about Dr. Weiss. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.